Hello everyone and welcome to this topic of chronic kidney disease. I represent the Salvadoran Renal Foundation, and in this opportunity I would like to talk about the epidemic of chronic kidney disease in Central America. My name is Xavier Vela. I'm an international medical graduate from El Salvador, Central America. I also represent the National Health Institute of my country, where many of the research that I'm going to present in this opportunity was carried out. So, to begin, as a matter of introduction, I would like to say that the chronic kidney disease in Central America has a social and epidemiological characteristics that are very particular, distinguishing it from the traditional behavior of the CKD in most part of the world. I'm going to present a few statistics to show you how is this true. Also, Central America has a double burden of this disease because in Central America we have the chronic kidney disease of traditional causes, hence caused by hypertension and diabetes. But also in Central America we have this chronic kidney disease of non-traditional causes. This increases morbidity and mortality that overcomes the limited financial capacity of these countries. But to understand better chronic kidney disease of non-traditional causes, we need to move forward into the agriculture, because chronic kidney disease of the agricultural communities emerge in the context of social determinants headed by poverty and its sequel. Profound social and human repercussions in patient and family have been shown by this disease. Consequently, the Ministry of Health of El Salvador, known as MINSAL, has developed several actions with the objective to stop this complex and devastating epidemic. Then, I'm going to move forward to explain a little bit about what's chronic kidney disease for those of you who don't know exactly what are we talking about. So we have this definition of chronic kidney disease, and this definition was updated in 2014. And so what's the definition of chronic kidney disease? Chronic kidney disease is defined as abnormalities of the kidney structure and function, present for more than 3 months, and also with implications to health, regardless the cause. From now on, I'm going to refer chronic kidney disease as CKD. We also have this classification of CKD based on the renal function, and we develop these stages of CKD that the stages goes from 1 to 5, being 1 those patients that are normal or at risk, and 5 represent those patients that they need one modality of renal replacement therapy. These patients are known to be called as patients in kidney failure or end-stage renal disease. But what are the causes of CKD? I'm going to talk about the traditional causes of chronic kidney disease, and worldwide we understand that the behavior of the CKD is epidemic, and the traditional causes, I mean the causes that happens around the globe, are diabetes mellitus, which accounts for the most part of the cases, and also arterial hypertension, mainly associated with risk factors such as unhealthy lifestyles and aging. So we see this very often in developed countries, when patients with kidney problems probably are either diabetic or hypertensive patients, and this is the traditional as we know so far. So which are the numbers? What are the numbers? So I came up with this research, this systematic review about the prevalence of chronic kidney disease in several population-based studies, and I'm going to show you a few numbers of the prevalences of chronic kidney disease in developed countries. As we can see here, the numbers of CKD prevalences vary according to countries and can be as low as 5% and as high as 16%, for example, in the USA. But I have to clarify the fact that these prevalences are taking out from population of all ages. I'm sorry, from population above 18 years old, I mean adult population. But what happens if we concentrate only on people greater than 60 years old? And now we see numbers can even increase up to 50 or even more, 50% or even more. So this, in the traditional behavior of the CKD, is mostly related with the traditional causes and also in people over than 60 years old. So this is the traditional. But what happened in Central America? What is all this about the CKD in Central America? So this is a map that, well, exactly you cannot see my country right now. This is a very bad map to see my country, but if we put our attention on the magnitude by countries, and you see the numbers over there from 1 to 19, you see over there that Nicaragua and El Salvador, those countries have the highest mortality due to CKD in the world. And some figures claim that is up to 4 times worldwide mortality in only those two countries. So El Salvador, which is my country, by 2007 the mortality rate was about 35 per 100,000 population. And if we look below, we see this graph over there that shows mortality and the trend by year. And we see this first point over here, 2000, and we see the mortality over there, 27.3. And then by 2008, we see that the mortality has become the double, and the graph doesn't show any sign of decrease. So the mortality is increasing in these countries, and probably it's gonna get even higher. And all of this data is available online. You can see over there the source, so you can check it out as well. So many researchers have come with this, and they want to share their thoughts, their experience, and I came up with this recent research published by a prestigious journal called The Lancet Global Health. And I want to share with you this phrase from the phrase Ramon Martinez, that I really like this phrase. It says that an immediate and coordinated action and response, despite the causes of the epidemic, are not entirely clear from the public health and other related sectors to address the epidemic of chronic kidney disease that currently is sweeping across Central America. I like this phrase because the author highlights that despite the causes are not yet understood, we cannot delay the efforts to bring these patients an answer, because these patients don't know exactly what's going on with them. So that's why I like this phrase and I wanted to share with you. Okay, so what about the CKD of non-traditional causes? It's not only in Central America. We also have reports worldwide. As we saw previously, Central America is one of the most affected areas, but it's not the only one. We also see reports of the same disease, the same behavior in countries like Egypt, India, Sri Lanka, and even Vietnam. This is very important because many other researchers claim that the CKD of non-traditional causes should be called Mesoameric endemic nephropathy, hence focusing only in Mesoamerica. But if you review the literature, you will find several reports of the similar disease in other countries. What are the common elements in these countries? Well, each of these countries has a very strong farming tradition. There are several farmer workers over there affected by this disease, and the clinical characteristics are very similar. Okay, so uh, by 2009 up to 2015, my country developed several research that helped to understand a little bit about this problem. We started with epidemiological studies. This research developed during 2009 up to 2012 reached about 5,000 subjects of both sexes and all ages. Then I will show numbers of those research. Later on, we moved to the multidisciplinary clinical study. This is a study that was carried out taking patients from the epidemiological studies and put them in the hospital setting. So we chose 46 subjects of both sexes and we studied them by 22 specialists. And also we found very interesting results with there. Later on, we had the international conference in April of 2013, where our former minister, displayed in the picture, she strongly advised that the problem of CKD in El Salvador is pressing and serious, which also represents a burden for families, communities, health system, and society. She led the conference and called all the stakeholders of Ministry of Health of the region to show them what are the findings in Central America region. We also have studied the soil and the water. We did environmental and occupational research from 2009 up to 2015, and we mapped the area affected. And each one of the dots that you see here, the yellow dots, are stored in a database in which you can, for example, you can click on each one of those yellow dots, and then a screen will display the name of the patient, the area of the patient, the the occupation, and also what stage of chronic kidney disease has this patient by that moment. And now, the national survey is currently ongoing, and the results will be released later on. And this national survey was carried out because in my country there's no an official figure about what is exactly the prevalence of CKD, how many people is affected of CKD of non-traditional causes as well. And many of this information you can access them online through this journal called Medic Review. It's an open source peer review journal, and they dedicated an issue only on chronic kidney disease of the agricultural community, so you can check it out online. So now we move to my country, and this is my country. It's a very small country, and now I'm going to show you the prevalence of CKD by the region. I'm going to show you the numbers of the prevalences of each one of those regions that are shown by the dots. These are the regions that were studied. If you pay attention closely, you'll see that, for example, the region of Ahuachapan, Bajo Lempa, and Las Brisas are close to the coastland of my country. But then we have Las Pilas community, which is a community located in the highest uh, land of my country. This is only rainforest, and the weather is very cold in these areas. You also see the picture that I displayed over there. This is not a matter of casualty. I incidentally want to show you this because the prevalences that I'm going to show you were mostly related with people involved in the farming labor. And these patients, they spread poisons and agrochemicals all across the fields without proper protection. So I'm going to start with the first region that we studied, and this is the region that we have a better understanding and better follow-up, is the Bajo Lempa region. You see the prevalence of CKD around 15% for both sexes and adults. Las Brisas community showed the highest prevalence in our studies, 21%, sorry. And Ahuachapan showed a very similar prevalence, and Las Pilas also showed a 13% prevalence of CKD. If you pay attention, these prevalences look very closely to the one that I showed you at the beginning of the prevalences of the developed country for the elderly population. But this is not elderly population. Here we're talking about adults of all ages from 18 years old. So we came up with the question, what's going on with the children? What happened in those who are below 18 years old? So we also carry out a research about that. In 3 regions only, we studied the children. And here are the numbers of the prevalences that we found there. It's very interesting that the prevalences kind of resemble a little bit those prevalences of the developed countries, but taking in account younger population. So this call our attention because now we're seeing children that are showing some degree of chronic kidney disease. So now I'm going to show you how the kidney function of the Bajo Lempa region, which is the region that has been studied most. I'm going to show you how the glomerular filtration rate, which is the measurement of the kidney function in this community, behaves. So in one axis we have the kidney function, and the other axis represent the age groups. And you see how the kidney function declines in the female, in the males, and also in the total population. And you see how the GFR, the kidney function, is decreasing from ages earlier than we expect. I mean, we see the decline in the decade of 11 to 17 years old. And from that point and on, the GFR is always decreasing. You don't see any recovery. But if you also pay attention to the early ages, around 2 and 5 years old, the GFR is higher than expected. I mean, these children are hyperfiltrating. Hyperfiltration is sometimes related with a damage to the kidneys, and the kidneys are preparing themselves to overcome this damage, and they do this by hyperfiltrating. So this was very interesting, a very interesting finding. Okay, so how does the CKD behaves in these communities regarding gender? And we divide CKD prevalences by males and females. So in any way you classify CKD, you will see that the prevalence is always higher in the male population. And also, if you pay attention, the prevalence of CKD of non-traditional causes is grossly half the prevalence of CKD in this population. This means that for half of the patients in each one of those communities, we don't know exactly what caused them their kidney disease. And if you see the bottom of the table, you will see the CKD in farmers and CKD in non-farmers. And the prevalence of CKD in farmers is also higher compared of those who have no relationship with farming. So this also called our attention because there must be something in the farmers that predispose them to have higher prevalences of chronic kidney disease. Also, this disease is not exclusively present in males. You see the female also affected by chronic kidney disease, but some might argue that the female are not involved in the agricultural work. In my country, most of the agricultural work is carried out only by male. But the female, they live with these men, and these men sometimes carry their chemical products with them in their clothes with the bare hands. They store them in their houses, sometimes underneath the bed in the kitchen. So you have this chain of exposure that, for some reason, one can think that can be related to the highest prevalences of CKD in my country, I mean in El Salvador. So what happened with the traditional causes? I mean, how the diabetes and hypertension behaves in these communities. So I'm going to show you what we found. Of the three regions, Bajo Lempa, Huachapan, and Brisas, that we studied, you'll see that diabetes mellitus, which is the main cause of CKD worldwide, it's only around 10% to 15%. Hypertension, it's around 20%, and in Las Brisas is around 44%. The proteinuria, greater than 1 gram, this can be understood of nephrotic range proteinuria, hardly reaches 5%. So the CKD of non-traditional causes is around half of the prevalences of the people with the CKD. In other words, half of the patients don't know exactly what caused them the CKD. Another way to see this with this graphic in the Bajo Lempa region, and we have here the CKD with hypertension. It's only 28%. We also have the CKD with the nephrotic range proteinuria, only 2% in this community. CKD plus diabetes, the one that one expected to be the most, is only 16%, and 54% of the patients have CKD of non-traditional causes, hence patient with no other comorbidity associated. So what are the main characteristics of this disease? According to the studies, how can we how can we understand the CKD of non-traditional causes? Well, first, I'm going to talk first, according to the prevalences that we saw, we can conclude that prevalences are high. Even though these are only a few communities, these few communities show really high prevalences, reaching around 21% CKD. The gender is to show a very specific trend affecting male more than female bodies, but this is not only exclusive of the male, also the female are affected. What is interesting is the age of the age where the CKD starts, and is early ages, less than 60 years old, since adolescence, and some that suggests the fact of hyperfiltration. This is interesting because in most of the communities we studied, patients refer that they start their agricultural labor at around these ages. And according to geography, what areas of the country are more affected? Of course, mainly rural areas are the ones that are affected. These are the areas where the agricultural communities predominate in El Salvador. So these are a few characteristics. We also were able to see, um, according to occupation, that mainly farmers are the ones affected. But not only farmers working in sugarcane fields, because one of the regions we saw, Las Pilas, the one that is surrounded by rainforest, that region does not work in sugarcane fields. They work mostly with lettuce and other type of vegetables, but they also use the same type of agrochemicals. What are the non-traditional risk factors? Well, bad laboral conditions. These patients uh, work without protection. They don't use the proper equipment to spread the agrochemicals, and most of these agrochemicals have been shown by research developed years ago that contain heavy metals as a contaminant in the process of the manufacture of the agrochemicals. And the urine markers were really, this finding was really interesting because we didn't found many albuminuria, but we found NGAL and beta 2 microglobulin, which are proteins that, when the kidneys are damaged in the structure called the tubule, the tubules and the interstitium, these two proteins can be shown in urine. And also we found electrolytical disbalances in these patients. And the fact that that we found these two proteins called our attention to focus on the interstitium of the kidney, because the interstitium is affected mostly by drugs, environmental factors, heavy metals, and poisons. And we were able to confirm this finding by doing histologic studies that the biopsies done to these patients showed a chronic and tubular interstitial nephropathy, very, very characteristic in these patients. Finally, not only the kidney was affected, in the study that we carried on in the hospital, we found that several organs and systems were affected. We found peripheral and neurological damage, vascular damage in the lower extremities, and hearing loss that was not explained by the progression to chronic kidney disease. So around half of these patients can explain their CKD by the traditional causes. And we have also these extrarenal features of the disease that suggest that the renal damage is only one component of a more broad process. Here we're seeing a very systemic disease, and we focus our efforts on the kidney, but this certainly, if you look at this disease from the point of view of hematological alterations, you probably are going to find something over there. So, by the research we performed, we were able to achieve several things. And one of the things that was really helpful was the development of the human resources. The government of El Salvador and Cuba worked together in the development of human resources. That helped to strengthening the healthcare system because a lot of healthcare providers were trained in the research. Also, because of this, education was another of the achievements of this project because actualization seminars and courses about CKD were carried out, and training of primary care providers was also a very good outcome from this research. And nutritional counseling, the Salvadoran Renal Foundation has a very strong tradition in training nutritionists to treat specially this kind of patients. For those patients that were diagnosed earlier, medical assistance was provided accordingly and quickly. Screening drove to better management, and also the renal health unit was created in one of those communities. Because of this, the infrastructure was fertilized. The renal health unit provide outpatient peritoneal dialysis. They receive training, they receive counseling, and they also receive treatment. And this was integrated to the healthcare system of El Salvador. And all this experience led to more research from the epidemiological and clinical point of view, and also from the environmental and laboral point of view. And also another one of the biggest achievements was the creation of the Salvadoran Renal Foundation that now has a very active participation in the community, not only with the patients, but also with the press, but also with the community, in creating these educational activities. For example, the Renal Nutrition Congress that is carried out year by year in El Salvador. But we also have challenge that we need to overcome. And one of the biggest challenges in this regard is the need of funding. We need to increase funding. It is mandatory to conduct research on prevention from the healthcare and other institutions, and to do that, we need funding. In El Salvador and Nicaragua, these countries have a very low budget directed to research, and most of this research is carried out by donations of other countries and organizations. If we want to move forward, we need to do more research, and in order to do that, we need to increase funding. We also need to prioritize. The healthcare system needs to understand that CKD is an important problem, and it's an important issue of public health. It's even more deadly than violence itself. We need to organize the healthcare system to provide an integral approach. And we have also a population very young population, kids that are affected, we need to, to look at them and to provide them an answer. And besides that, we need to improve the health. We need to improve the health services. We need to approach the health services to this population. This population are located in areas with a very difficult access to healthcare. Um, we need to find strategies to address better ways to increase health coverage. Primary care providers also need to be trained, and telemedicine could be a very good field to explore in this regard. We also need surveillance. We need to create the renal registry. Uh, we need we need the creation of surveillance system for the countries of the region that help with the detection of indicators of morbidity and mortality due to CKD. So these are the challenges, and uh, thankfully we are not alone. Many organizations and many other people has a proud have a proud have a, club come close together to us to help us, and that's why we have the opportunity to work now with the Salvadoran Renal Foundation. So the role of the Salvadoran Renal Foundation in all of these problem is to develop research from the clinical perspective to understand the risk factors that can explain the high incidence of CKD in El Salvador. This, of course, will lead to the early detection and prevention of those patients that are detected early, and to provide treatment for those who are already in the advanced stages. And other of the purposes of the Salvadoran Renal Foundation, and maybe its cornerstone so far, is education. The Salvadoran Renal Foundation had developed several programs addressed to healthcare professionals, but not only to professionals. It also reached the community. It teach people on how prepare food for for these patients, how to prepare healthy food, how to it get really involved with campaigns of hydration, exercise, and so forth. But also we need to reach politicians and decision makers, because these people sometimes have the power to address this problem. But if you are interested and want to help, please consider to make a donation to our foundation. There are several ways to do so. I'm going to describe a few of them. You can send a check to the address that's displayed on the screen. Just make sure to put the name of the Salvadoran Renal Foundation in. But if you prefer to do it online, you can do using your debit or credit card through newyorkcharities.org. You can follow the link, but just make sure that if you use this method in your statement, will reflect nycharities.org instead of the name of the foundation. It's only, as a matter of fact, the Salvadoran Renal Foundation is a non-profit organization registered in the state of New York, and so all your contributions are tax deductible. So this is it, and thank you very much for your attention. Please have a nice day.